All right.
Ready to roll?
Yes. So we're going to talk to you about the core this morning and how to train your core function and stability safely from here on out. So basically setting all of your movements up for success. And I'm Erica.
I'm Kyle, her husband, and we're chiropractors out at Coulee Health in Salem. So we treat the spine like a traditional chiropractor, but a little bit more of a rehab focus and background, and some of the concepts that we incorporate are from dynamic neuromuscular stabilization and DNS. So a long word for a fancy word for what we're going to talk about today, basically. But it's really cool, not only in a treatment setting or a rehab setting, but a performance setting, and just kind of how it applies to life. And we're going to be talking to you about that a little bit today, and also like the performance aspect as well.
So I guess my niche, I would say, is with females through the motherhood transition, so pregnancy through postpartum, especially in the postpartum period. But the really cool thing is that it doesn't matter if you're male or female, pregnant or not, that we all should move the same way. We should move how we were born to move, but over time we get away from these movements. So yeah, the dynamic neuromuscular stabilization is what our training is based off of. It's just a technique, but it's based on the principles of our developmental movement from babies, ages like 0 to a little over a year. But I want you to give me a little bit of what your knowledge is, or what your understanding or mental idea of what is your core. So when you think about doing core activity or a core workout or taking care of your core, what comes to mind for you? And just, you can shout some stuff out. You don't have to raise your hand or anything.
Abs.
Okay. Like six-pack abs?
Yes.
Yeah.
Hey, Boland.
Yeah. Okay. Good.
I'm right here.
Yeah. Okay. Cool.
Yeah.
Yeah.
I think about stabilizing the spine in line with like the hip
Okay.
as one solid unit, from shoulders to hip.
Yeah.
That's good.
Good. Yes. To all of this. The abs. So that's the most common for our patients when our patients come in, and we start to talk to them about the core. It's usually like this. What? Because there's a lot of emphasis in the fitness industry and also in mainstream media with this portrayal of how we should look, and that includes this, like, you need a six-pack. So usually if someone has a six-pack, their rectus abdominis muscle, that's what your six-pack is usually overactive. So we're going to talk to you today how to train from here to here, okay? And I do a lot of pelvic floor rehab through these same movements that we'll talk about today. And so usually especially when male patients hear that, it's this like, oh, but you also have a pelvic floor, so it pertains to you too. So yeah, your core is actually your axial skeleton, which is your trunk. So everything here to here. And when we're born, nobody teaches us how to move, but we have these movement patterns or motor patterns, and our motor patterns actually start to develop in the womb. So you see ultrasound and baby's already moving. That happens. That's an innate motor pattern that's coming from the brain to the body. And pending that there's no major issues, we progress in the same way from 0 to about a year old. So if babies are left to develop on their own and not put in like a bumbo or extra saucer or whatever before they're ready, then there's a pretty predictable sequence on when they'll roll over, when they'll sit up, when they'll walk, when they'll crawl. And each of these motions are crucial for functional development from here on out. So your movement patterns now, if you came into our office there may be things that if you've got a shoulder issue and then we find out that you never crawled, then we can kind of relate that. So your movement patterns now relate back to how you developed. But that doesn't mean you're stuck there. It can always be progressed, right? So babies, have you heard of the term diastasis? So the diastasis of the rectus abdominis, maybe some females are more familiar with this because it is common postpartum. It's a split in your rectus abdominis muscle. It's a symptom of an instability in your core, and there's certain things in life, like injuries or pregnancy, that exacerbate symptoms or make them more obvious. So babies are actually born with that. If you were to try to take a little baby and pull them, you never see a baby sit straight up. It's totally dysfunctional. And what is that? That's a sit-up, and we're driving those home, right? But not functionally. So if you took a baby and had them flex forward like that, you would see this diastasis. And how they heal it is through their own movement. They obviously aren't thinking about this. It's just their brain is motivated to move to the blue block in the corner. So that stimulation is what connects brain-body movement, okay? So when we do training for your core, we emphasize those basic motor patterns. So we have what is called, it's based on the DNS principles, and I've got some posters back there that I'll show you, but we call it the functional progression. It's like, have you heard of a Turkish get-up? Okay, so it's like that, but we say it's a Czech get-up because this research is all out of Prague. So basically here in the United States, we're up against a few issues when we're training. We're up against aesthetics because we're very aesthetically driven. People, it's hard to get that out of your head. I mean, if you're scrolling through Facebook, subconsciously you're sucked into it, right? So we need to get away from how we look and more towards how we feel. We're also stuck in this phase of single muscle activation, and your body doesn't work that way. You don't decide, I use this example with my postpartum moms, doing for your pelvic floor, doing Kegels. I don't ever get up and think, okay, I'm just going to Kegel my way back to the vehicle. It doesn't work that way. Like, you can't just activate pelvic floor and get anywhere. We have to work, all of our core has to work simultaneously. And every single movement that you do, whether you're sitting posturally or whether you're squatting or deadlifting, everything is translated through your core. So that's why you need this as a solid foundation, and you need to train it functionally instead of doing just single muscle activation. In order to build on top of those extra movements like squat, deadlift, running, whatever you want to do, builds from that foundation or those building blocks. So once we teach this foundation, usually I always get the question, well, what's next? Because we always want more. We want to add more. And what's next is the higher movements that you're working on in here. That's working your core to a higher level. But as far as core movements, what we'll discuss is really basic, so basic that it almost seems like, oh yeah, why are so many people missing the boat on this? But if you can give intention to that training regularly, then you will set yourself up for better success, developing strength faster and safer in other higher level movements, what we would call, right?
Yeah. So, kind of jumping on that, so if people come in and she mentioned a shoulder injury, or whether it's a hip injury, a knee injury, ankle injury, a lot of times our treatment will start at these principles, like the core, because as you mentioned, it's not just like a knee issue. Obviously, your knee is connected to your ankle and your hip and the rest of your body, and you're not just doing this stuff all day. You're incorporating your whole body. So it's very important to have these fundamentals and this foundation in place, so that way, increased performance if that's what you're looking for, or just healing from a current injury or preventing a future injury. Having that in place, so that way when you come into the gym here and you're doing a snatch or whatever movement, you're going to be much safer in terms of putting yourself at risk for injury, whether it's an acute injury, you lift and all of a sudden you just feel it, or it's just a chronic overuse. You feel like you do a heavy deadlift day and your erectors are on fire rather than you feeling it, in your glutes and hands. There's a reason for that. You're not using the proper muscles. So that goes back to the correct motor patterns, and really that comes back to the core of being able to stabilize. So it applies to everything. Or if you're just at work at your desk, obviously that's involved as well.
With BirthFit, so Nikki's actually going to California with me to work on becoming a BirthFit coach, which is awesome. But with BirthFit, we talk about doing things with intention. So you have a choice on how you want to move, and you have a choice on how you want to train, and a choice in your posture. Like, you have a choice in everything. So if you're doing things with intention, mindfully, working on this, then you're just going to develop. So we have motor patterns, right? We're born with those. That's our innate patterns. It's what physiologically how we develop. And then movement patterns can change over time, but your habits will become your movement patterns, right? So if you sit like this all day at a desk, then you're going to be, you're going to have overactive in anterior chain instead of, so that's why we talk about like training your posterior chain, because so much of society is here. But it becomes chronic. So you have to train with intention, breathe with intention. So your core, like I said, it's your axial skeleton, but when we're talking about building intra-abdominal pressure through a lift or through a movement, we're talking about diaphragm, pelvic floor, internal and external obliques, transversus, rectus, and your erector spinae, okay? So those are the muscles that you should be training rather than singling out rectus or even singling out transversus. Transversus gets a ton of credit, especially for females, but it has to work in conjunction with other movements. So when we talk about building that pressure, Kyle's going to go over this more, but those are the muscles that we're talking about, and bracing outward and preparing to be able to move safely and effectively, but also still using your diaphragm for breath through that movement, because you have to be able to breathe, right? So your diaphragm is a muscle, and it attaches in like mid-low back, basically, okay? So it starts here, attaches down here. You use it for posture, so for stability and for breath. It's a muscle, so just like any other muscle, if you don't use it to its full capacity or full range of motion, it decreases in function and it decreases in range of motion. So when we have a patient come in, like he said, with a certain injury, and we're starting with, okay, we have to teach you how to breathe again, because it's really common for us to come here. When you suck your belly in, your diaphragm is doing exactly the opposite of what you need it to do. So I tell patients, you can suck your belly in 2 times, cocktail parties and pictures, and that's it. Although, and I think it's just really hard for females and males as well, because there's this notion of, like, again, how we need to look. So when we have them start just with breathing, sometimes it's really difficult, but then we can actually work some soft tissue up underneath to get to diaphragm, and immediately they'll feel a little bit better. But again, you have to retrain those patterns so that you're using your diaphragm like you need to. That is the first step in stabilization of the core when you're a baby, and returning to it if you've lost it now. And one last thing before Kyle talks further into that, I frequently get asked, because people want to know, like, okay, well, if we're born to move this way, then what happens? Like, why all of the sudden, or what happens over time? Well, I say, this is my opinion, but I think that a lot of it has to do, if you watch kids move, if you want to see a beautiful squat, watch a baby squat. It's amazing. And they don't think about it like we have to. But then age 5 or 6, you're stuck in a desk all day long. And what does that do? Those amount of hours behind a desk seated are affecting your diaphragm, they're affecting your core, if your kids don't care about posture and they were used to moving this way, so then they're stuck in it. So that's where I think it starts. And then different things along the way, depending on what your job is, depending on an injury you have, whatever, can just make that worse sometimes. So when you're training, what we want to help you with, and we're going to try to get through as much as we can today. We'll likely do another one, which is more active and hands-on and teaching you the actual movements. But when you're training, you are either training for stability and progress or training compensation, and that's your choice. And sometimes you've got to peel it back and drop back a little bit in order to make safer gains faster. So it becomes very mental and physical at that point. Do you want to talk more about intra-abdominal pressure?
Sure. Before that, like even the motor pattern, so I think a good analogy for that, a motor pattern is just a message from your brain to via the nerves, via the nerves to the muscle. So it's the brain telling the muscle to move, okay? And the more you use that pathway, the more the brain says, for example, the erectors. The more you use those erectors, the more prone the brain is to be like, turn on. Like if your body is really good at just accomplishing a task, it doesn't really care how it gets done. So if you're going to bend over to pick something up and then you're going to lift it, the body doesn't care if you're using glutes or hamstrings or erectors. You just want to lift this heavy box up here. So if you're always using erectors or training them, or when you're training, if you're not stabilizing properly and you're overactive there, you're going to be more prone to use that, and then that's when you get that sudden injury. You're just more at risk for it, or they just become chronically tight. So if you envision like a grassy field and you drive out into it, you're going to see like tire tracks in the grass. That's like a message from the brain to the muscle, like if it happens once. But then, after a while, the wind blows or whatever, and the grass kind of grows back up and you can't see it. So if you're training a muscle and you just do it once, like that's good, but you have to repetitively do that. So if you're driving that grassy field like repetitively back and forth, pretty soon you start to see tracks, and then you get like dirt and then like ruts. So then when your brain wants to activate for a certain movement, that's its go-to, because it's just got the ruts there, so it can just do that. So as she mentioned, like just continually doing these things, like they're pretty basic, but just incorporate it into your warm-up or whatever. You're going to be more prone to use the proper muscles when you're doing like the more complex movements and reps. In terms of the intra-abdominal pressure, so she talked about the diaphragm, which is probably, it's crazy just the connections that it has above and below, just like viscerally, and all the nerves that go through and everything. Like it's ridiculous, but in how we're talking about it, it's just going to be more just in its contraction. So if you envision your core as like a container, okay, you have like a canister. The top of it is the diaphragm, the bottom's the pelvic floor, okay, top bottom. Then you've got transversus, rectus, erectors, everything around the sides, okay? So that's like the canister right here. If I hit at top on it, would be the diaphragm. So if we envision that as like two pop cans, okay? And we take both pop cans and they're full unopened, and we open one of them, okay? So now we've got a full unopened can and a full opened can. And you go to step on it. If you stood on them, which one's going to withstand more force? Unopened can. The only difference between the two of them is pressure. This one has pressure in it. So unopened, I can probably pretty much almost stand on it before it crushes, put a lot of weight into it. It has a lot of pressure there. The open one, it's going to withstand some force, but it's just going to eventually crush down. It doesn't have that pressure for stability. So that's what we're trying to create in the core, is good intra-abdominal pressure. So if you're sucking in, you're removing all that pressure. But when you breathe in, and this comes out all the way around, that's creating pressure. That's where your stability comes from. So then you're prepped for a good squat or deadlift, anything below that type movement, or any type of movement up here. Okay, how much stronger are you up here? If you suck in and try to do something, or if you really brace down and then you're ready, that's where your power comes from. That's kind of the concept behind like a lifting belt. Okay, you're going to put on that belt, it just tighten it up, cinch it up. That's increasing the pressure. Okay, that's all that's doing. we're training you to be able to do that yourselves. Belts are still good if you're gonna, you gotta lift heavy, you're gonna max out or something. It creates that stability. It's also nice to have to really breathe into, to kind of brace into. But ideally, for a lot of this stuff, and you guys aren't using them for your movements either. So if you can train that yourself, you're able to train a lot of that stability. The other analogy is if you take those same hot cans, say we open this one now, so they're both open. If we dump them out, so 2 open, empty pop cans. This one's perfectly cylindrical, kind of like this coffee mug. And this one over here, we're going to put a dent in it, just a dent in the side. When we go to stand on them, the cylindrical one, it won't withstand as much force because it doesn't have the pressure, but it's going to withstand a lot more. Whereas that dented one, it's immediately going to crush. So if you think of your core or your canister like a pop can, it's a lot of things you guys probably train in here, is you don't want to get that dent in the pop can. You're going to lose all your power. It's called an energy leak. Okay, you can create all this power, you can have the strongest legs in the world. Okay, so if you're generating that for a jump or a lift, but then you have that energy leak here, then you're, first of all, you're unstable. So as Colton said, like the spine and everything, you're setting yourself up for injury there, and you're not able to translate that force, whether it's in the upper extremity for a snatch or something. So you want to keep that pressure, and then you want to maintain this perfectly cylindrical core all the way around. So those 2 concepts are going to get a long ways, take you a long ways just for relating to the core.
And when you think about, like, when we talk about, I tell my patients to never do a sit-up or a crunch again in their life. And if you're going to choose to do that, then you have to do equal amount of work to undo the single muscle activation that you just did, right? So there's some movements that you'll do that are more functional or less functional, even within CrossFit, within anything. But to move more safely through those movements, you have to do this work. And then to counteract, maybe, like if you're going for PR, or if you're in a competition or whatever, you're gonna just go balls to the wall to try to do your best. But then, yeah, you need to do a little bit of work to maybe peel back another layer of the onion that you just created through maybe some compensation. But if you're training this way, your muscles are more likely to be that way. But when you're doing sit-ups, you're repetitively creating that energy leak over and over and over. So it's, in little kids in school, they think they still do the sit-up test, and it's like, and military is actually starting to get away from it now. They're finally catching up with research, but it's awful for your low back. And Kyle, what did you call it? Energy leak. I think J-Lo booty is more fun, but so we say, like, with your pelvis, you don't want J-Lo booty and you don't want plumber's butt. You want to be neutral right here and be able to feel that expansion all the way around, right? So just try where you are to take a breath with your diaphragm. So sit up nice and tall. And when I say sit up nice and tall, it's like somebody's got a string through the top of your head, not like you're coming out here with your chest, but neutral here. So you should be able to feel your low back, and it should be nice and flat across your low back. You're bracing a little bit, like if I was going to come up and just drive my fist into your gut, you wouldn't suck away from me. You would brace against it, right? That's the kind of brace that we're talking about. So now try to use your diaphragm to breathe. So if you put your hand here, you should feel this expand as you breathe in. So what happens, you can keep practicing that. So try to keep your shoulders down, and your chest can expand out, but it should not come up. If your chest is coming up, your diaphragm is coming up, and your diaphragm should be going down when you breathe in. So it's kind of this, like, you got to wrap your mind around this to help your body understand this movement. So seated, if you're going to start working on this, seated is actually way more difficult than laying on the ground with your feet bent or your feet up on something, because it puts your pelvis, your diaphragm and your pelvic floor should be parallel to one another. So it forces you into that position, and then you can sit and put fingers here and breathe into it. So something to work on. We recommend 5 to 10 minutes a day to work on that, because when your diaphragm is working right, your pelvic floor and your diaphragm have this counterbalance, so it's also strengthening your pelvic floor, and then in setting you up for success in the rest of your core function.
So a lot of times we'll start a patient just like she said, laying on their back, and as if their feet are like this. So if you envision you lay on their back, my feet are at like a 90-degree up in the chair or something, and then just starting to work on the breathing. So just, all right, activate your diaphragm, create this pressure, and if you envision like a balloon, because a lot of times it's awkward for people because maybe they're not as good at it, so then they kind of start getting this down, and then they'll kind of be like uncoordinated. And it's an exercise, but it's not like an exercise you're doing here where you get tired. It's a thought exercise. You're working your brain. We're really trying to create those motor patterns. So it's frustrating almost because you're trying so hard and you're thinking about it and you know what you want to do, but you're trying to activate that. But then people will start to get like, a little bit of abdominal pressure created, and then it's kind of like out of conjunction, like with this chest raising and everything, and then they start to get it down. It's like this stuff stays quiet, and they get really good coming forward, and that's good. But the core, if we took a cross section and looking down, it's not just forward. You have to create that 360 all the way around. So it's like a balloon. Okay, so you don't want to just do it to the front, but to the sides and the back as well, and that's where it gets really difficult. Because up here is pretty easy, but like to the front and like down is tough. Really to the sides is tough, and then to the back is quite hard. So if you kind of just wrap your fingers around the iliac crest here, you can get your fingers down low, you can kind of feel it there. You can feel it in the web of your hands laterally, and then with your thumbs you can feel it posteriorly. And sometimes that really gets challenging, and if you're laying on the ground, you can just almost breathe into the table, but your back should be flat against the table.
If you have a TheraBand too, they actually just created, it's called a 360 belt to train this. So it goes around, but if you have a TheraBand to put around you and force yourself to expand into that.
Even a waistband, like sweatpants or shorts, it's like you're trying to expand that waistband evenly 360 all the way around.
Yeah.
And then the belly button, like if you look at the side, like the apex of that balloon, it shouldn't be at the belly button. You want to try to aim for it to be about 2 inches below. So you're really trying to get that pressure as low down as far as you can, because that's kind of a more dead area. The lower you get it, the more like you're going to keep it out of up here, and it's just rock solid down there.
And it becomes a dead space. We call it a dead space. It's not really dead, and we don't want it to be. We want to wake it up. But it becomes a dead space because of overactivation in hip flexors and because of chest breathing. So it isn't naturally a dead space, but it becomes that way. So when you look at little kids, it's like you never see them walking around with their bellies up. They've got these little Buddha bellies, and it's adorable. And then we grow into this concept that can't happen. So I encourage you to work on this. And I'll lay down here and show you. So if I'm here, and you want your chin tucked, you want your back flat on the floor. So I'm not here like this, because that puts me in an open scissor energy leak position. My diaphragm and my pelvic floor are no longer parallel. So I'm here, and again, it's even easier if you put your feet up on something, and then I'm breathing out. But think about what this looks like if you took my body, just how it is, pretend I'm like stuffed or something, and set me upright. It's almost like a really beautiful squat form. Or if I was seated, it would be a really good posture. So that's why we start to stabilize here. This is also with babies. One of the first movements that they start to stabilize in is coming here and here. And that's when they start to build their intra-abdominal pressure, okay? And then they'll start to be able to move one arm, but not across midline. And then they'll be able to, they can touch their groin, then they can touch their knees and their feet. And if you get nerdy, like I am about it, then you can see this sequence occur. So that just waking your diaphragm up is the first step in training your core. And I want to show you these holsters. So you can see, like Kyle said, he said, adding it into your warm-up. So if you knew it was going to be a leg day, you'd probably do a bit to warm your legs up before you started, right? Well, you need your core all of the time. So if you start off with a little bit of core work to stabilize your core, even if it's in the morning and you don't work out until night and you want to do a little bit, once we teach you the functional progression, if you want to do a little bit of that in the morning, then your core stabilizers are activated because somebody mentioned the spine involved in your core. And all of the muscles, or most of the muscles that we're talking about have some sort of attachment with the spine in this area. So yeah, I mean, all of it should be working together simultaneously. So you can see, we start over here in the prone position, so on their belly. And so here's the baby, and then here's the adult right next to him. And basically, what we do with core training is start here. Sometimes if you're in our office for treatment for shoulder or chronic neck issues or acute neck issues or whatever, we'll start you in this prone position because we have to teach you to shut your traps off, shut your pecs off, and activate serratus and lats because that's common for the general population, let alone when you're putting a ton of weight on a bar and moving it, right? So we start here. And then we don't make you actually grab your genitals, but it's just showing you how to breathe. So we start here and then we go into the rolling. So a little background history on it, I guess. I had a patient that came in and she was postpartum and she had double prolapse, I'll say, for lack of getting into too much detail for you and her. But she had a double prolapse and I was like, okay, we'll try this because this is what I know helps the core. So for me at this point it was more just starting to make sense, like this is how we need to be training our pelvic floor as well, not just singling out Kegels. So with her, I think it was like 6 visits, we just did the functional progression and it was way better because it creates so much stability. But what I realized in working with her was that the transition between these movements is as important as the movement themselves. So when I don't think we'll have time to get all the way through these movements today because I want you to have time to ask us questions. But when we go through this, it's nice because at first you seem like, okay, so every day, like this is a little bit just, it can get boring, but there's so much you can do with it that you can make it exciting on your own. But when you go from laying on your back, so supine, to rolling to the side, the transition between is extremely important because you have to train stability through that transition. Is a really easy way to compensate. So like I just showed you, I was here, and then the next one would be to roll to your side and come up on your arm. So frequently what patients do is this. So then it's like the 80s. Side crunch. I don't think anybody really does the side crunches anymore. But what you want to do instead is be here. So I'm bracing out, I'm breathing, I'm here, I'm coming over, and I'm turning, and I come up off of my elbow and using serratus. And all of this stays neutral right here. So I'm not here, I'm still here, I'm not dumping everything into my low back. Everything stays neutral through here. So just the roll in and of itself becomes an exercise.
Anybody can do the movements from one to the next. It's kind of like how you stabilize during it. So, right. And that's what I think people get caught up on a lot is, oh, this is the exercise, well, let's do it, and then they just go like, oh, I can do this easy, I can do it really fast, I'm going to get good at it. But it's not about the movement, it's about the quality of the movement and what you're using to accomplish that movement. So, yeah, you can roll over, but you can do it poorly, or you can do it, put a lot of focus in it, retrain those, proper muscles, or maybe not retrain, maybe you have them already trained, but you're just, continuing to drive on that road, making those ruts. So that's very important. It's like any movement, any movement.
Well, Nikki said too, specifically with some gymnastics movements, and I don't know if you guys are if you work on that quite a bit in here, or even just, if you thought about a handstand push-up, or kipping, or anything, you have to utilize your core. So if you are in a handstand push-up, and your core is less functional, we'll say, or in an unstable position, you're putting yourself at risk. Like Kyle said, whether it's right now or whether it's down the road, I have no idea what happened, but all of a sudden my back just kills all of the time. So using intra-abdominal pressure as much as you can through those movements, all of them. And did you want to go into any detail with anything in specific with that?
No, I think the concepts just apply basically to about anything.
There are movements, so like with a kipping pull-up, there are movements where you're going to become, that's a movement where you're going to become a little bit disconnected. Toes to bar. It's not exactly the most functional, but it's part of some of the workouts, right? So, I mean, you can get super neurotic about it and just totally avoid them. But I have a feeling that that's not realistic in here, right? You know.
But when you're coming through in those movements, maybe you're opening up, but then when you come through, you're coming through that area. Okay, when you come through your wheelhouse, have that pressure there.
Yes.
That's where your power creates, and then you're gonna come up out of that much more efficiently. It's gonna make it easier.
So like back to the transition. So when you're transitioning through those movements, if you are training your body to naturally like fire down this pathway, then when you come through that movement, this is what you're going to come back to, and it's what's going to be your go-to instead of. I mean, at first it's probably going to feel like, oh, I don't know what, I got to wake all this up, you know, and it's okay. It's never too late to activate it, but yeah, you're going to move through those motions much safer and much more effectively. And at first, it might be a little bit difficult, but yeah, it's humbling. But eventually, you'll feel it, and it doesn't take very long to catch on if you can intentionally make it a part of your training, right?
Some people want a quick fix, and sometimes that's possible. But if you think about how long these motor patterns have been, ingrained, it's going to take a while to kind of retrain those patterns. And so, I don't know. It's frustrating. It's hard for me myself, but I don't know how long ago it was when I started like really working on it. I was like doing some really intentional breathing, just in my position on my back, just working on that, and then working into some of the transitional movements, but just super focused. And I think it was later that night. I was at home and I couldn't get a full breath in. Like like you're trying to breathe, and sometimes like you can't get like all the way, like that full breath, and it was super frustrating, and I could not get it. I didn't know what was going on. It was really weird, and I started to freak out. And she's like, kind of like, you idiot, like you should know this. But,
I didn't say that.
Like, you just worked your diaphragm like super hard, and you hadn't been doing it for how long? So it's just like any other. Maybe you didn't do squats for 6 months, and then you go in and pound out 100 squats. Yeah, you're going to be sore. So my freaking diaphragm was so sore. I had to go to bed.
And that's when you get into like the mobilization, when you feel like I cannot get there. I can't. Then yeah, you've got to work it. It's a process. So okay, so let's give some time for questions. Yes.
Can you discuss like common injuries you guys have seen in your treatment and like symptoms people come in with, and then what ended up being related to, or the area that you needed to fix?
Yeah.
Because I didn't get all.
Yeah.
Probably, honestly, I bet it applies to everything. But common injuries, we talked about upper trap, like tightness up here, just because all that gets activated with this chest breathing or carrying that tension up there. So even if you're not always breathing that way, but you have that tension, it's just more tone. You have this tightness. So if you can activate this, it's going to allow all this to relax, and over time, it's just going to kind of melt, which is amazing. So if you go in and get that massage every single day, even, we could go in there. We could grass them like the soft tissue work. We could grass them the crap out of your trap and beat them up. Yeah, they'd be tender, but then they'd be like really loose and be like, oh, this is nice. But if you don't retrain the patterns, it's just going to come back. So it's all about kind of bringing it back. That carries up into this neck stuff. I mean, everything. All being tight up here. Shoulder issues because you're up here or maybe you're rounded, so you have to be able to keep this while keeping your shoulders here. Shoulders are nice because there's not a whole lot of bony contact. It's all like the rotator cuff and soft tissue things. So you can make a lot more changes with soft tissue than bony things. So shoulder injuries, unless it's like a bad tear, are usually things you can help if you're doing the right things and avoiding bad things. a lot of
It's
hip stuff,
retraining
like
how to use
adductors.
your shoulder in a stable position, basically. So when you come into us as chiropractors, a lot of people are like, oh, sometimes I don't even adjust people. But, and if you have a shoulder issue, Kyle gets excited if you can't tell about shoulders. So I send those patients to him. But, yeah, it's just retraining those muscles to work while keeping your shoulder in a stable position instead of repetitively training compensation. So you have to retrain. It comes down always to retraining the motor patterns. And I use this example too. Like if you've been to a chiropractor and you've had your mid back right here adjusted and it's like, ah. So I could do that probably every hour for kids at school that are sitting like this. So if they're coming into me and I adjust them and it feels great, and then they come in an hour later, I can adjust. So you have to retrain. You have to get to the bottom of what it really is, because things can, even an adjustment or Graston or whatever, can be a Band-Aid, and it can help short term, but long term, it's a process to retrain how you're moving and what's going on. Same with, I would say we get frequent low back injuries too, especially.
A lot of this type of posture. Hip flexors get tight and pull it this way. Erectors are tight, so they're pulling it up here, and then that's that kind of the dent in your canister. So as he mentioned before, again, it's keeping like your entire core, that cylinder all the way around, and then keeping that pressure in there. So if you go here, you feel your erectors; they're going to be like super rock hard. But if you even just like squeeze your glutes or tuck your tail between the legs and then feel them, you can feel how they're softer. And then if you can actually be in that position and then really stabilize here all the way around, then your erectors are like, wow, they're soft. They can be soft. Like then they're not having to stabilize, because why they get so hard is because you're not creating all this other stability. So your body's like, okay, we got to create stability somehow. So it's like, all right, you got to do it, so the erectors do it. So it's good that you have that stability, so your low back doesn't like majorly get hurt, but it leads to chronic.
Over time it will. And when you think about like hollow hold position, okay? It is the majority of the population cannot stably hold a hollow hold properly with proper intra-abdominal pressure. So if you are doing this, I'm not saying don't do it, but train intra-abdominal pressure, train your core, start working on this, so that if you're going into a movement to hold that position, that you can hold it with pressure and stabilize through it. So you can feel it too. If you take, like he said, if you take your hand and across your low back and you feel just erectors like this on both sides, then the cue that I found, for some reason, I can tell people to tip their pelvis back and it doesn't help, but as soon as you tell them to tuck their tail between their legs, the tail that they don't have, that for some reason clicks for them. So that is, it kind of makes you realize, like, okay, if you say tip your pelvis back, a lot of times they're like, well, which back? So just doing that, and it'll feel just smooth and relaxed almost across there. So yeah, I would say like shoulder injuries are super common, in low back injuries, especially in people that are moving a lot of weight. And our goal is never to take activity away from you. We want to know what is your goal within your activity, because movement is life. So if you're not moving, you're dying, basically, So if I don't like to have to, unless it's a major injury, I don't like to have to take movement away from people. I want to train them how to move better. Maybe we have to dial the weights back a little bit for a couple of weeks, which can be almost as difficult, but training, you have to wrap your mind around the part that like this is going to get you farther sooner and then longer if you give this the space, but never to try to remove you from your activity, because that is physically and mentally keeping you going most of the time, right? Do you have, is that cover kind of, or do you want more specific, like, yeah? Okay.
Any other questions at all?
Yeah, does anyone else have anything?
Can you go back to the 90-90 again? I just want to show, like,
because I think this would help with the hollow holds. So a lot of times when people lie here, it's kind of like trying to find a balance between all this. Like she said, the low back should be flat against the table, and she's got her pressure 360 all the way around as low as possible. And then for people to lay here, a lot of times they want to flare their ribs, or their ribs just, they don't want to, but they can't help it. So then we like, all right, tuck your ribs down, and then their chin will come out. It's like, well, you don't want to do that either. So then they tuck that, and then the shoulders round, and it's just like this huge balance. So
it can be a mess.
It's challenging, and so just working, just laying in this position and stabilizing here is going to allow that. Obviously, maybe you should pay attention to stretching your pecs a little bit, but it's all working towards this, and like she said, it translates to all that, but it's going to work towards a hollow hold, and then just incorporating these concepts in between the movements and the transitions.
And people get really discouraged when you do this, and then this happens, and then this happens, and they're like, what's wrong with me? It's so common, but it's so easy to fix if you just give a little bit of time with it daily, that we don't get as worried as you can see just the fear in people's face when they are told they don't know how to breathe, basically. So, yeah.
I have a question kind of related to the back pain. So I'll get it sometimes when I'm trying to do plank, like still dull, pain that is all is that, so that can be fixed by really focusing on that breathing, or it's weird because it happens like this.
In a front plank?
Yeah, when I'm just on a plank and or in the other exercises that I've done where it's also
I could see how that could happen, because a lot of times in the plank, especially after a certain amount of time, we start to fatigue, and then the hips start to tip. It doesn't happen all at once, but it just gradually, slowly starts to tip. You get this tip. So if you can try to really focus almost on squeezing your glutes while you're there, and then keeping that pressure, it's going to allow the stability. My guess is you're kind of just slowly falling into that moment, that grab, whatever it may be, muscular or it's kind of pinching because you're falling into that. So if you really, kind of apply this to that, and really think of that pressure, and then the pelvic positioning. And I think like the pelvis, a good analogy too, is if you think of your pelvis like a bucket of water, and you don't want to spill water out the front. If you just think about keeping your bucket full all the time, I think that is a good way to think about it as well. I mean, obviously you're going to be kicked when you're doing a plank, but...
And maybe something to do too is to take, I mean, I know if you're to the point of fatigue, when you're in a plank, it's not that easy, but take your hand. When you start to feel it, take your hand and feel what's going on down here. Have somebody else feel it, or take a picture, or whatever.
A lot of times the erectors will get really tight, and that's them stabilizing rather than all this stabilizing. So if you're able to stabilize properly and things like that, the erectors really shouldn't be that tight. And that's issue.
When we see like a hip impingement, that's common too with people that are doing a lot of heavy lifting. What we'll like the hip impingement, a lot of that is just overactive anterior chain, so overactive hip flexors, not using enough of your glutes to bring you back up and not stabilizing here. So as you come down, you're automatically here. So your quads come up and attach. So if you get quad tightness, if you're over-activating quads and hip flexors, it's automatically going to pull you into this, and then that lengthens your hamstrings. So then a lot of times when people are like, oh, my hamstrings are so tight all the time, they're stretching them. Well, they're tight long. Like they're stretched to their max because you're here, right? Does that make sense? If it comes here to here, I can loosen it a little bit like this, or I can lengthen it. And if it's tight long, you can stretch it till you're blue in the face and it's still going to feel tight. But you have to learn how to use this pressure and stabilize on the way down and use your dang glutes to come back up instead of just pulling from here. So you'll see people sometimes do a box squat, and if they come back up out of it really fast, they'll just totally grab from hip flexors instead of activating the posterior chain. So maybe do a couple of squats really, really slow so that you feel your glutes fire, spread your feet if you need to activate glute med. That helps control external rotation and stability here. Because I don't remember ever adjusting a knee or a shoulder because in the knee we say it's like the bastard child. It's in between. It's either because of your foot or it's because of your hip and core. It's not, unless you have a direct blow to the knee, it's very, very uncommon that it's actually the knee that's the cause of the pain. Yeah.
So if you're gonna, do one thing to fix that, like anterior tightness,
Mm-hmm.
would that be it? Would it be just like focusing on slow squats, really hammering the glutes?
And,
or is there anything
and
else?
using intra-abdominal pressure at once. So I would start with your intra-abdominal pressure because you need that to open up this space. When we talk about this dead space that occurs down here, and I'm not even to that point where some of the instructors, so this is all out of Prague, and when they come and teach, and they can get up off the floor with space open right here, and it's like harder than hell because you're totally coming from your glute, and they're so trained that way that it's just, that's what happens. So yeah, you need to train to be able, so when you come back into the box squat, sit and tuck your tail between your legs and feel that space, pressurize, and then lift up. So yeah, giving yourself a little bit of time to train that so that when you're in the middle of a WOD, that's your go-to, and you don't even have to think about it. It takes a bit to get there, but it doesn't take 20 years, even though you've been creating these, it doesn't take as long, thankfully.
Yeah.
I have another question that relates to that intra-abdominal pressure. So if you're going for a heavy set of something, say, would you recommend contracting your pelvic floor before you take that belly breath to maximize that intra-abdominal pressure to stabilize that pelvic floor, or do you? Because for a long time I've just been ignoring that pelvic floor and kind of just taking that pressure in, but I've noticed if I contract that pelvic floor and then breathe into it, it feels like I have a more solid base and I can almost pressurize it. Am I doing that correctly, or am I wrong in the sequencing?
So when you take the breath with your diaphragm, your pelvic floor should be activating on its own, but not like held tight, right?
They're nervously connected though. They're connected, there's a connection between the two nervously. So it's automatically, when the diaphragm is going to contract, the pelvic floor will get a contraction as well. It's like they just work together. They're connected that way.
So you don't need to put too much conscious thought.
You wouldn't have to.
No,
if it helps you, I would do it still. But as long as you're getting that pressure, but you don't want to work in isolation. It's almost like if you're going to push a truck or something, you're not going to do this and push a truck. You want to get all this pressure brace, and you're going to go to push it. It's almost like that.
And we had, I cannot remember who, so if you're in the office and we're doing DNS, we also do what's called Voita therapy, which is some stim points and whatever. So we were at a seminar learning these stim points, and the instructor said, obviously females give birth, and so that puts their pelvic floor in a totally different position than males, but males also pee standing up. So their pelvic floor is activated. So he recommends females to literally functionally squat over the toilet when they pee to help keep stability in their pelvic floor. And I was like, what? But it makes sense when you think, or you could just pee in the shower, I guess. But it makes sense when you think about it. You're not sitting when you're peeing. You're not sitting and totally letting that relax. So you just automatically have a little bit more of that activation than
you are working on it too, if you're laying on your back working on it, put your hands here and make sure you pay attention that you're symmetrical from side to side, because a lot of times people will, we talked about the dead zone, sometimes people have a dead side. For me, my right side isn't as active, so I almost try to breathe down into the right a little bit more. And talking about conditions and stuff, a lot of times people with adductor tightness, you'll see that with a core that's not properly firing or pelvic floor stuff. Like typically, always adductor tightness is due to that. So my right adductor I have troubles with being more tight, and it's because I can't do that because I'm not creating this stability here. So then the adductors are like, all right, we got you. Don't worry, we're gonna get tight. We'll create that stability. But
Yeah, like you said before.
Can you show them where their adductors are?
Adductors are the inside of your thigh. It's like your groin. You
So
know,
another area, especially with females, that it's like, my adductor. So your adductors attach on pubic symphysis, which is like your bone right here. So like he said before, your body is going to get from point A to point B no matter. That is one way that you can determine, especially in females, but also in males, that there's a pelvic floor instability because your adductors are just holding on for dear life to try to compensate for that. So yeah, I mean, I will talk with Nikki, and then we'll come back and teach you the functional progression so you can implement this. There is video on our website, and we left some cards. If you have, our emails are on our cards too. If you have questions or whatever, just email. Let Nikki know. Let us know. We love questions. So thank you for being a good audience, and we'll let you do your workout.